Hello, and welcome to the August OhioISP Gathering, supporting SSAs. My name is Mandy Brooks. I'm a Regional Support Facilitator with DODD in the Office of Quality and Innovation. This recording is specific to SSAs. If you are a QIDP, we have a recording specific to you for this month. Feel free to go back and check out that recording on the OhioISP webpage. In this particular recording, for SSAs, we will discuss the new waiver rules, all the changes, and how to incorporate this information into the OhioISP. Joining me for this recorded gathering is Leslie Powell. She's also a Regional Support Facilitator with DODD. We'd also like to give a huge shout out to our special guest speakers today, Amanda Rowlandson and Lisa Cirillo, both Medicaid Health System Specialists with DODD's MDA office. We are excited to speak about the new waiver rules and how you can align these rules with the OhioISP. Just as in recent months, this August gathering will take place in this recorded video format. We will have regional office hours later this month, and you can find them on the OhioISP webpage under Regional Support Gatherings. Thank you for joining us for this month's OhioISP Gathering.
Quickly, before we dive into the new waiver rule, we wanted to briefly remind you of what was discussed in July's gathering. During July, we went over technology and how technology can be incorporated in the OhioISP. Technology can be easily addressed in the OhioISP and assist with a technology solution. We spoke about how technology can increase safety, promote independence, help the person feel in control, a solution to meet the needs across their lifespan. If you haven't had a chance, please be sure to go back and watch July's recording, or you can look at other previous recordings concerning the OhioISP on the webpage under Regional Support Gatherings. Without further ado, we would like to introduce Amanda Rowlandson and Lisa Cirillo. Both Amanda and Lisa work with the Medicaid Division and Administration. We want to extend our gratitude to both Amanda and Lisa for assisting us today with a new waiver rule and how it aligns with the OhioISP.
Thank you so much for that warm welcome, Leslie. My name's Amanda Rowlandson. I'm a Medicaid Health System Specialist with the Waiver Policy TA Group. And Lisa and I are here today to talk with you about the changes that were effective July 1st of 2022. We also want to give you some good examples of how these changes can be added into the OhioISP. Our agenda is going to be going over the changes in the Level 1 and Self waivers. We're going to talk about updates to the participant-directed goods and services. We're going to talk about changes to home-delivered meals. And we're diving in deep for self-directed transportation, that new kid on the block. The OhioISP group has given great examples throughout this training on how these changes are going to be added into that new OhioISP. Lisa Cirillo, can you tell us why we made these changes?
Thanks, Amanda. It would be my pleasure. Hello, everyone. My name is Lisa Cirillo, and I'm a Medicaid Health System Specialist with the Waiver Policy Technical Assistance Team. So why were changes made? Over the years, DODD had received feedback from county boards, people that we serve, and their families, expressing that the structural and service differences that existed between the Level 1 and the Self waivers caused there to be confusion, and they were difficult to navigate. This was especially true when a person had to move from one waiver to another. So several years ago, DODD began working with stakeholders to simplify the structure of the Level 1 waiver and to better align the service packages of the Level 1 and Self waivers. This process is referred to as waiver simplification. This first diagram illustrates the service packages of the Level 1 and the Self waivers before waiver simplification. As you can see, there were several services available to a person through the self-waiver that a person could not access if they had a level 1 waiver. Through waiver simplification's goal of aligning the level 1 and the self-waivers, a person with a level 1 waiver now has access to 5 services that were previously only available through the self-waiver. Specifically, these services are participant-directed goods and services, clinical therapeutic intervention, functional behavioral assessment, and participant family stability assistance. In fact, when you look at this diagram, you'll notice that support brokerage is the only service that is only available through the self-waiver and not the level 1. Amanda is now going to tell us more about the changes that were made to the level 1 waiver.
Let's take a look at the level 1 waiver changes. The first thing we want to talk about with the level 1 waiver changes are the 5 new services that were added. First, we have the functional behavioral assessment. This is an assessment that helps a person understand why they do the things that they do, why they sometimes feel upset or stressed, and it helps explain the relationship between the actions and the environment. This assessment can be completed once annually per waiver span, up to $1,500. Once you've completed that FBA, you can also utilize clinical therapeutic interventions. This helps a person meet the needs identified in that FBA. It includes things like help from a counselor or a psychologist, help making plans to limit challenging behaviors, and training for people who support the person on how to carry out that plan. We also added participant-directed goods and services. You might be familiar with this from the self-waiver. This service can be provided up to $2,500 per waiver span. It includes services, equipment, or supplies that are not otherwise provided through the waiver or Medicaid state plan services. The participant-directed goods and services needs to address a specific assessed need, and it needs to be outlined in the individual service plan. We also added participant family stability assistance. This is training and counseling that enhances a person's ability to direct services received and or enable them or their family members who live with them to understand how best to support. And the last one, the brand new one, self-directed transportation. This is a transportation available around the clock, including weekends and holidays. It's to accommodate those on-demand or even scheduled transportation needs through public transportation options or even a person that the participant knows, and it's facilitated through the financial management entity. Some of the major changes that we've seen with the level 1 waiver are around the funding structure. Adults have a total of $45,000 and children have a total of $30,000 for all needed waiver services for the waiver span year. Funding limitations for adult day waiver services and non-medical transportation are no longer in place. This means the acuity assessment instrument that we use for acuity groups are still used for rate setting purposes for providers, but no longer dictate a bucket of funds available. People that are currently on the level 1 will shift to the new budget at their first waiver redetermination on or after July 1st of 2022. And finally, emergency funding is no longer available through the level 1 waiver. Lisa Cursillo, can you tell us about the self-waiver changes?
Thanks, Amanda. 2 services have been added to the self-waiver package of services. These are self-directed transportation and home-delivered meals. Self-directed transportation is a service that allows people with disabilities to travel independently. It can accommodate both scheduled and on-demand transportation needs, including trips that need to take place on holidays and weekends. Home-delivered meals is a service that provides meals that are prepared, packaged, and delivered to a person's home to accommodate their dietary needs. These meals can be standard, kosher, or therapeutic and are authorized and added to a person's ISP based on their assessed needs. We will provide greater detail about both of these services later in the presentation. Participant-directed goods and services, often referred to as PDGS, includes the services, equipment, or supplies that are not provided through Medicaid state plan services or by another waiver service. PDGS does not require that the equipment and services be provided by a Medicaid certified provider. Before discussing the changes to PDGS, it's important to start with what participant direction actually is. Participant direction means a person has authority to make decisions about their waiver services, and they accept responsibility for taking a direct role in managing the services. Participant direction includes exercising budget authority and employer authority. And ultimately, this allows a person to have more control over how waiver funding is used. Now let's talk about the updates. First, a definition for participant-directed budget was added to the rule. The participant-directed budget is the total amount of annual waiver funding available for participant-directed services in the ISP. A person may reallocate funds among participant-directed services as long as the ISP is revised first. Language revisions were also made to the rule to shift the focus from a PDGS purchase being the least expensive and towards addressing an assessed need. The language revisions also move the focus away from medical necessity and to the habilitative intent of home and community-based services waivers. Another change to participant-directed goods and services is that county boards are no longer required to have a cost comparison process or DODD established review process. Instead, county boards will now complete their own review process for purchases of $500 or more. Pools, spas, saunas, food, internet service, and items of general utility are prohibited under PDGS. And a full list of prohibited purchases can be found in the PDGS rule OAC 5123-9-45D3. DODD review is still required for certain items, and this includes generators, fences, play sets, home adaptations over $10,000, and items that would otherwise be available through state plan services, other waiver services, or as a provision of IDEA or identified in a child's IEP. Although participant direction does allow a person to have more control over their waiver budget, it's still important to keep in mind that a PDGS purchase must be directly linked in the individual service plan to a need clearly identified through assessment. And the service, equipment, or supplies are required to do at least one of the following things. First, decrease the need for other Medicaid home and community-based services, or advance participation in the community, increase a person's safety in their home, offer the person greater independence, improve cognitive, social, or behavioral functions, or assist to develop and maintain personal, social, or physical skills. Leslie and Mandy, would you be able to share an example of how PDGS might look in the Ohio ISP?
Sure can. Thank you, Lisa. On this slide, we have an example of a person, Billy, who is using participant-directed goods and services to purchase swim lessons. As Lisa shared, just like other supports, it is important that the goods and services are linked to a need clearly identified in the assessment. The top of the page shows just a portion of Billy's assessment, which references his desire to be with friends and do what they do, like going kayaking. But Billy expressed a concern that he doesn't know how to swim and would feel better if he could take some swim lessons in order to help him safely participate with his friends and get to go on the kayak. Billy and his team opted to use PDGS to fund swim lessons, as they found it would advance his participation in his community and assist him to develop or maintain personal and social and physical skills. In the paid support section of the Ohio ISP, we see that the provider is listed as the Financial Management Service Provider Guardian Track, LLC. They're also known as GT Independents. OhioISP pulls the provider's information from PSM. So this is how GT Independents is listed in that system as Guardian Track LLC. So they're listed as the provider of service, and then we see that the assessment area of this paid support is related to social and spirituality, that the funding source is his level 1 waiver, the service's name is participant directed goods and services, and we see that PDGS will pay for the support of swim lessons 1 time per week from the YMCA for Billy, costing $115 per month. I also wanted to point out that the team may consider this as a potential piece of an outcome for Billy.
Next, we want to talk about home delivered meals. This is a service that provides meals that are prepared, packaged, and delivered to a person's home to accommodate their dietary needs. These meals can be up to twice a day and now include standard, kosher, and therapeutic meals. Changes that you're going to see to home delivered meals is really that all 3 therapeutic, kosher, and standard home delivered meals are now available across all waivers. The ISP and the CPT must identify which type is authorized. You need to ensure that the type of meal, number of meals per week, and type of drop-off service is listed in the OhioISP. Therapeutic meals must be prescribed by a licensed healthcare professional. These include but are not limited to the things such as pureed diets, less sodium, or sugar-free diets. We've listed a graph below that shows you the rates for each of those meal options. Mandy, can you show us an example of how this will work in the OhioISP?
Sure will. Thank you, Amanda. Here we have an example of Tina. We see from her assessment that she doesn't require any specialized diet or any special kind of food. Her assessment also shows that she doesn't require any assistance during meal times, but that she does prefer her meals to be prepared for her so that she does eat a well-rounded diet. Down below, we see from her planning section that Tina chose We Deliver Meals as the provider of her home delivered meals. And so we see them listed as the provider of service. And then we see the Healthy Living is the assessment section that this service is connected to. That her level 1 is the funding source. Service name, of course, is Home Delivered Meals. In the scope of the service, remember Amanda said, ensure that the type of meal, the number of meals per week, and the type of drop-off service is listed in the ISP. So we see that Tina will receive 7 frozen standard meals every Monday between 8 a.m. and 9 a.m. and the amount of $201.60 per month. This will happen weekly, and we gave the span date there.
I'm excited to share with you the new service of self-directed transportation. This transportation option really enhances a person's independence. It allows a person to travel independently. It's an option that's available around the clock, including weekends and holidays, and it's going to accommodate those scheduled or on-demand transportation needs that a person may have. So let's dive right into the different options that are provided through self-directed transportation. It can actually be used in 2 ways. The first way, you can purchase prepaid vouchers, cards, passes, or tokens to access ground public transportation, meaning Uber, Lyft, buses, cabs, any type of community transit system. The second option, a person may also use someone they know, such as a family member, neighbor, or friend to transport them. This person can be approved through the financial management services, and that new FMS is GT Independence. Self-directed transportation can be used to take you to a plethora of places. Ultimately, it can be used for your competitive integrated workplace or community job to get you to and from work. It can also be used for integrated community participation or contribution, like your volunteering activities, social events, clubs, or groups. It can be used to get you to those community resources like going to Job and Family Services or the Social Security office, going to the local library, getting an appointment to complete your taxes, or even going to the grocery store. Also, there's other activities and opportunities available in the broader community, like going to basketball or hockey games, meeting up with friends for dinner, or going to a regional self-advocates meeting. Really, it's based on the person's needs. What do they need to get to, and how can we get them there? So you're probably asking, how do we add self-directed transportation to the Ohio ISP? Well, the person should discuss the needs they have with their SSA, ask about what public transportation is available in the community, and talk about all available options to get them to and from the places they need and want to go. The SSA can then talk with the person about supports available through the different waivers or from other resources that can help meet their transportation needs. And then you're going to add that information into the ISP about the provider that's chosen, the amount of money that they're going to need for that transportation, and ways that they want to use this support. And I believe we have a really good example on the next slide of how this is going to be added into the Ohio ISP.
Thanks, Amanda, for that great information. On this slide, let's look at how self-directed transportation can be added to the Ohio ISP. Like other examples we've shown you, we will start out with the assessment section under social and spirituality. The question asks, does a person belong to any clubs, groups, or organizations? When and how often do they go, and how does that person get there? As you can see, Morgan wants to be more active and she wants to do more things, but she really needs assistance with transportation to get to different places. She wants to be able to join her book club in person. She wants to meet her boyfriend and go out to eat, shopping, attend local advocacy group meetings. Because most of these places are so far for her to walk, she really needs assistance with transportation. Morgan is very independent and really wants to utilize transportation on her own and not rely on staff or anyone else to get to and from her activities. After further discussion with her SSA, she really wants to try an Uber card. She really feels that that's going to meet her needs and not be dependent on others to provide her transportation. So again, after further discussion, they really thought that the self-directed transportation would be the best way to go with Morgan. It helps her enhance her independence. It's available around the clock, including weekends and holidays. It accommodates her schedule and her on-demand transportation needs. So when we're looking at planning and moving forward, we're looking at planning and paid supports. You will see who is responsible, and that person is Guardian Trek LLC, and it's a financial management service regardless of what rideshare she's using. So I know before I said about having, Uber, or, maybe we talk about having, some type of specific taxi service. Um, Regardless of that, Guardian Trek is the financial management service. So that's what you're going to put there. And her funding source is HCBS IO waiver. The service that is needed is self-directed transportation. And the scope of service, Morgan is going to use a rideshare for rides to go to meetings, shopping, dinner dates. And it specifically calls out that she's going to keep her receipts. We want to make sure that you put, what the supports are going to look at, like along with the scope in this section. And then we're moving forward to how often and how much the SSA really spells out. Morgan is to purchase a transportation transaction card monthly. It's $100 per month for 6 months. And you'll notice her span date reflects that it's going to be reviewed in 6 months. So you really want to take your time to look at that. The team's going to reconvene in 6 months, see how things are going, talk to Morgan, and then go from there. We want to thank everyone for joining us today. And as we end this session, I would like to go over some housekeeping items. SSA statewide office hours will be August 30th from 10 to 11. If you have any questions concerning waiver policy, please reach out to Amanda or Lisa, waiverpolicyta@dodd.ohio.gov. For more information on waivers and services, you can visit dodd.ohio.gov/waivers and services. And if you have any questions concerning Ohio ISP, you can always email us again at ohioisp@dodd.ohio.gov. Thank you so much for attending today and look forward to seeing you soon. Thank you.